Go.
Hi, I'm Grace Henderson, and this is my audience. Did you know that every 1 in 3 people are diagnosed or come into contact with hepatitis? Hepatitis is one of the many infectious diseases that we have come to discover. Therefore, what is hepatitis? How do I get it, and how do I cure it? Here's some information regarding this disease. Hepatitis is a very complex disease that can be very fatal. Some background information on hepatitis is that it is an inflammation of the liver. Hepatitis has 5 different types and levels of the disease, and all 5 types have different names and symptoms that go along with it. Some of the names are HAV, HBV, HCV, HDV, and HEV. The doctors decided to put that into an acronym just to help patients understand more clearly what their disease was, and just for notes to make it easier to write. Some hepatitis research, according to the University of San Francisco, is the studies are new, but the disease is old. So studies came out in 1971 was when they started blood testing, because they didn't know what caused hepatitis until they started to discover. And they found out that it was from some viral infections that had stemmed from different particles that people had contaminated or just didn't clean properly on their food. Research also found that anyone who contracts the disease is prone to liver cancer and or might need a liver transplant in the future, depending on how hard your body takes the disease and what level you have of the disease. The CDC also recommends that you be tested if you were born between 1945 and 1965, if you are a patient to a mother who has had HCV, and if you've ever used or inhaled drugs. This is very important to find out if you have the disease and could potentially cure it. Some symptoms of the diseases are hepatitis, according to the CDC and Mayo Research Clinic. Our hepatitis B and D are very similar in the illness form, but also the symptoms. And the overall symptoms of all the diseases combined are about the same wavelength, and they last about the same time and have the same components, such as jaundice, nausea, weight loss, easy bruising, loss of appetite, fever. All those could be symptoms of hepatitis, but they're also symptoms of very common colds or illnesses, which is why they're not always diagnosed. Ways you can contract hepatitis are through sexual intercourse, eating raw meat, or contaminated water with animal urine or feces. And this is why it was so popular back in the 40s, because things weren't getting cleaned properly in the package plants. There have been several recent outbreaks with hepatitis in the food industry, such as in 2016 there was an outbreak due to frozen strawberries and raw scallops. Patients and customers began falling quickly due to it. Some ways to cure hepatitis are through injection, called pegylated interferon. It's like a chemo drug, and it's used once a week, and that's for hepatitis B and D, is the same drug that they use to try to do that. All hepatitis has different levels of curability, and they try to cure as much as they can what they know. HBV has the same drug base as HCV has the same drug base as HBV, but it's an oral med called ribavirin. Instead of an injection, it's taken by pill once a week or twice a week. And HEV is the least fatal strand and goes away after time with lots of rest and just curing your symptoms as you go. In conclusion, hepatitis can be fatal if not treated properly. 5 million people are infected each year, 1.34 million die. New research is needed every day, and scientists are working very hard to try to find ways to cure it so less people die. And hopefully in the next few years, we will come to find a cure for the disease in whole and get that mortality rate down. Thank you.